folks, I hope you guys have been enjoying the different videos we've been doing the past few weeks and months in different scenarios. This channel is dedicated to medical students, medical residents, and other healthcare professionals. Today a short note about this condition, which was recently described and it's more and more often discussed in meetings and in journals. It's called the Peripapillary Hyperreflective Ovoid Mass-like Structures, the PHOMS. You may observe here and appreciate a patient with PHOMS after a focal vascular optic nerve condition. PHOMS, or peripapillary hyperreflective ovoid mass-like structures, are homogeneous, rounded structures around the optic nerve. In the past, they were found to be a subtype of optic disc drusen. However, they should not be diagnosed as optic disc drusen anymore. The acronym PHOMS describes very well the key features of the entity. P of peripapillary, age, hyperreflective lesions, O because the lesion is ovoid, round with some tip, cylindrical shape, and mass-like because of the three-dimensional structure of lesion, capable of displacing other retinal structures radially and outward. PHOMS have been identified associated with various diseases around the optic nerve. For example, anatomic abnormalities like tilting optic disc in myopia, optic disc edema from inflammation like optic neuritis or white dot syndrome, and vascular conditions like ischemic optic neuropathy and retinal vascular occlusion, as well as papilledema. Indeed, some of the common conditions associated with PHOMS are papilledema, AION, central retinal vein occlusion, optic neuritis, tilted disc syndrome, among others. The two main differential diagnoses of PHOMS are anomalous optic disc vessel and optic disc drusen. Anomalous optic disc vessel appears different because they are not hyperreflective like PHOMS. Optic disc drusen has some key features. Optic disc drusen, they are hyper autofluorescent. They are also often detected on B scan. Optic disc drusen is not found with papilledema. Given that PHOMS acts as a biomarker of exoplasmic stasis and may harbor a potentially life and sight-threatening disease, it's very important to recognize this ophthalmic sign on OCT and fundus imaging. The mechanism underlying the formation of PHOMS has not been well clarified, but the main hypothesis is it occurs as an exoplasmic stasis from a crowded optic nerve and nerve fiber layer bulging. The diagnosis is mainly performed with OCT with the several findings described already, like bulging of the retina and hyperreflective oval and round lesions around the optic nerve. The presence of PHOMS has been described more and more often, and it may correlate with the severity of several diseases important of the eye like non-ischemic, non-arteritic AION. So it's very important to keep in mind about this condition. I hope you like this short review about PHOMS. See you on the next video.